In this video, we will talk about the terminology which contain the oma word in the end, but they are not the benign tumor. As we discussed in the previous video, that oma is the suffix of the benign tumor which are developed by the mesenchymal cells. But we, in the medical terminology or in medical field, there are some malignant tumors which is used, and their name having oma in the end. So please don't confuse these oma to the benign oma. Benign oma, what is oma? Oma is used in the last or as a suffix in benign tumor which are developed by the mesenchymal cells. But be careful, some of the oma suffix which are not the benign tumor, they are very dangerous and these are malignant tumor. First, see here, ependymoma. Ependymoma is not benign tumor. Ependymoma, when developed, it is very serious. How? These are the ventricular cells. In the CNS, ventricular cells are present, which have ependymal cells. When ependymal cells occur and benign tumor, in the benign condition, the cells swell up, and here is growth occur, and it blocked the central uh, hemisphere fluid. CSF flow, it block the CSF flow. When CSF flow block, then body cannot compensate with any mechanism, and it can lead to the death. So ependymoma, it is very serious condition, and it is not the benign tumor. And the second one is meningioma. Meningioma, what is meningioma? When it grows, sometime it become very large. See here, meningioma, meningeal covering of the brain. It occurs in the meningeal covering of the brains, and when it become grows, sometime it is it is benign, but after some time when it grows, sometime it become very large and produce intracranial pressure. When intracranial pressure produce, and may produce dangerous complications. Why? When they produce intracranial pressure, then the heavy pressure in our cerebral hemisphere occur, and they alter our body functions and lead to the death. And number four, third, atrial myxoma. Atrial myxoma, what is atrial myxoma? It can produce some obstruction in the mitral valve, and that may disturb the blood flow of the heart. Uh, See here, this is the atrial myxoma. The benign tumor develop in the atrium, but it go and block the mitral valve. And if mitral valve will block, then we know disturb the blood circulation, and when blood circulation decrease, there are many problem can occur in our body. And number four is a pheochromocytoma. What is pheochromocytoma? See here, in this there is oma suffix is present in the last, but it is not simple oma, or it is not the benign tumor. When it is used, when adrenal glands secrete more and more catecholamine, so body go to the very dangerous condition. How? Catecholamines are control our body function, and if they are more secreted by our adrenal gland, then our body will go to the dangerous condition. So we got heavy danger. And insulinoma. Insulinoma is also not a benign tumor. See here, oma suffix is present, but it is not benign. What is the insulinoma? Insulinoma is the tumor of pancreas. And how it occur? The beta cells of the pancreas, which produce the insulin, they become neoplastic. When beta cells of the pancreas become neoplastic, they secrete a lot of insulin. And when our body secrete lot of insulin, then our blood glucose level will be low and hypoglycemia occur. And it is very dangerous condition. So this is not the benign tumor, this is malignant tumor and very serious condition. So these 4 5 and other terms which have in oma, but these are not the benign tumor, please be careful, and these are the malignant tumor and very dangerous for our body. Thank you.